Hey guys, Tony Maritato here, licensed physical therapist, and in this video I want to touch on the topic of Medicare Advantage plans versus traditional Medicare Part B for the beneficiary. Now, I tend to find myself on the opposite side of most arguments in our profession, and this is no different. There are a lot of clinicians out there that are sharing and floating around a graphic, an infographic, talking about how horrible Medicare Advantage plans are and how patients need to be advised to stick with Medicare, traditional Medicare Part B. But I want to show you the reality of the situation, at least from a consumer perspective. So let me share my screen. This is just one website that allows a person to look at Medicare Advantage plans. So I went ahead and typed in the zip code, Butler County, find Medicare plans. Now this is going to be specific to Advantage plans. And let's look at the cost of an Advantage plan related to the cost of traditional Medicare Part B. So if we look here, we can see that there's 62 plans available in the area. The first one that shows up is WellCare. There's no monthly premium. It's an HMO. So the beneficiary, the Medicare beneficiary, would be paying $0 per month, $0 for primary care copays, and $25 for a specialist visit. So we, PTs, OTs, SLPs, are typically classified as specialists. So the copay to the patient is $25 per visit. If I look at the second plan, another WellCare, 0035 copay. Typically when you see copays adjust higher or lower, there's other intangible benefits that are included. One of the things to consider here is, there's fitness benefits with this plan. Usually that's the Silver Sneakers program, which typically means that the beneficiary has a free membership to Anytime Fitness, a YMCA. Snap Fitness was involved with Silver Sneakers. There's lots of opportunities. The local senior center where I live accepts Silver Sneakers reimbursement. So let's see if we can find something else. Here's a Humana plan, Medicare Advantage HMO, 0 premium, 0 copay, $35. Now, granted, I acknowledge it's an HMO plan. It's a limited closed network. They don't have the opportunity to go out of network a lot of times. Now, here's a PPO plan. So now the PPO plan does allow the Medicare beneficiary to go out of network. Same, 0 monthly premium, 0 doctor copay, $40 specialty copay. And just, I can go on and on. Here's a coinsurance, 20%, 0 monthly premium. So understand the appeal to the consumer. I get added intangible benefits. I'm paying $0 a month. Most of the time I'm paying 0 for my primary care physician. And, anywhere between, so far we've seen $25 to $45 copays. So now let's compare that to a traditional Medicare Part B plan. So this is on Medicare.gov. We're looking at, these are looking at numbers from 2021 based on income from 2019. And if we're looking at the lower financial socioeconomic rung of the ladder, we're looking at $88,000 or less. These individuals are going to pay $148.50 in monthly premium for their Medicare Part B coverage. Now remember, that is in addition to, they're paying that monthly premium no matter what. That's in addition to the deductible, and they still have the 20% coinsurance unless they purchase a supplemental or some sort of secondary plan. So what does a supplemental cost? Well, let's jump back over to this website. Let's click on Medicare supplemental plans in this area. And I can see here, this is a Mutual of Omaha, a high deductible supplemental plan, Plan G. The monthly premium is $42. So we've got the $42 from this plus the $148 from that. So a little over $200 a month. Plus the patient would have to pay toward the $2,370 annual deductible on the supplemental. If I go down to this Plan N, Mutual of Omaha, the patient has the $203 Medicare or Part B deductible plus the $84 a month. So we come down here, $93 a month, $32 a month, but again, that's a high deductible plan. So if I look at, let's just go with averaging $90 a month for a supplemental plan that has no deductible, and $90 a month plus $148 a month. Let's do some quick math. 148 plus 90, that puts us at 238 times 12. Let me jump back in here. So times 12. We're looking at $2,856 a year that the Medicare beneficiary would be paying out of pocket if they went with traditional Medicare Part B, versus the zero monthly premium, the zero doctor visit, and the potential copay per specialty visit if they went with a Medicare Advantage plan. So the point of this is there are absolutely financial implications for individuals that maybe are living on a fixed income. Because remember, these were individuals in the $88,000 a year income category or less. Certainly many of your patients are probably making less than $88,000 a year. But the reality is that we can't just blindly say, because we as providers have more of a burden to work with Medicare Advantage plans, or we see from outside looking in that Medicare Advantage plans might be limiting the size of their network or who the beneficiary can work with. We can't make the determination that that is a bad plan. There is no such thing as a bad plan. It's a financial tool, a financial asset. Unfortunately, Medicare beneficiaries, and really the population at large, is not necessarily financially literate enough to really understand what is included, what's not included, how the financial impact of one plan versus another is going to affect them and their healthcare choices. Plus, I mean, the reality is we're trying to make the best educated guess we can. If I'm expecting to live in this area for the next 12 months and I'm expecting to have high medical expenses, I'm going to go with a Medicare Advantage plan. But you just don't know. So anyway, understand that there's more to it than just saying a plan is good or bad. I wanted you to see the financial impact of these decisions and then help your patients find the professional that will help them make these decisions, because it takes a lot of information, not just what is best for us as the healthcare provider. Guys, I wish you the best. I'll catch you on the next video.